Hello, this is Brian Devine, and I'd like to welcome you to the second of our four-part series on the voice of the American supply chain. This week, we're focusing on the reopening of America and the most pressing issues facing the front lines today, which is health and safety. Safety has always been an important part in industrial environments, but now health and safety are the most important determinants in getting the supply chain back to work. And it has an entirely new meaning today than it did before COVID-19. So to help our customers adapt to this new reality, we at EmployBridge have created an entire COVID-19 return to work guide. Of course, many large companies have developed their own policy guide outlining practices to mitigate the negative impact of COVID-19. But there are over 1.5 million companies in the US that have somewhere between 10 and 500 employees. And many of those companies simply don't have the resources to create a health and safety guide. So we'll help them out. I'd like to share a few highlights with you now, as well as answer some of the most common questions that we've received from our supply chain customers. So we've prepared for you a health and safety roadmap that includes three major steps. Of course, there's the opening protocols, there's the employee readiness, and there is the incident responses that identifies procedures in place for how to handle an incident if a possible virus infection. So what protocols do we need to have in place prior to reopening? Many of our customers are asking for a framework of the plan and the resources they need in place prior to opening. And we've created the following recommendations that you can modify to meet your site's specific needs, as long as they adhere to the local laws and regulations of your county. So we recommend that you create a pandemic response team that would be headed by the site manager. And the site manager will have the overall responsibility for the site's pandemic preparedness and responses. And then we suggest that creating 6 lead roles that have responsibilities in the following items. First is an employee access control lead. Second, a virus prevention and protocols. Third, a lead that handles the sanitation and disinfection. Fourth, a communication and training lead. Fifth, a personal protection equipment and materials lead. And finally, an isolation coordinator. And so we're going to cover each one of those individually, very, very briefly. The employee access control lead is the person who oversees the plant's entry protocols and the social distancing logistics. And this position supports the virus protection and protocols lead. The virus protection and protocols lead, this is the person responsible for establishing the standard protocols that will be in place and to help prevent that will help prevent the spread of the virus at your work site. And the most important thing is to keep up with the state and local safety guidelines that will be changing as we enter different phases of reopening. And it's their responsibility to make those appropriate changes. The sanitizing and disinfecting lead. This is the person that works with the virus prevention lead to establish and manage daily and periodic disinfection practices and how to drive continual process improvement. Once again, as the states and the counties change their. Now let's talk about the communication and the training lead. This person is responsible for ensuring that employees understand and are ready to follow the new protocols. Now more than ever, it's important to over-communicate with employees. And so we recommend that you use multiple vehicles to reach them and to also think outside of the box. For example, beyond putting posters in the break room, think about how best to use text alerts or printed handouts or signage and even social media. For instance, we have one customer in Reno, Nevada, who created a closed company group on Facebook where she posted updates, and it's turned out to be really effective. Next, we'll talk about the personal protection equipment and materials lead. This is the person who's responsible for making sure that you have adequate supplies, to open initially, but they're also responsible for proactively managing the lead times and the back orders to ensure that you have the materials that you need in this tight supply chain. So remember that something as basic as having adequate supplies of soap and hand sanitizers, it really allows your employees to feel safe. And then the last lead we have is the isolation coordinator. And this is the person who assists individuals who are experiencing symptoms on site. And in some cases, customers have asked us to staff this role for them with a person who has a medical background. We'd be happy to do that. Are there standard disinfecting measures we should be following? And yes, the site should be 100% disinfected prior to anyone returning to work. And you have to be careful to consider who's entering the site during the cleaning process to make sure that it remains uninfected. Companies are hiring professional firms for a baseline deep cleaning, and that way you know that the proper cleaning solutions and the protective gear and the waste disposal procedures are followed. Of course, you'll want to clean and replace the HVAC air filters in your building, and we've created a comprehensive disinfection checklist that's available to you to download. And we'll give you that link to find that information at the end of this presentation. Customers are looking for checklists to make sure that they cover all the critical items. And these are also available for download at the end of this presentation. And in response, we've created not only a disinfection checklist of the surfaces that you'll want to include, but we also created a checklist for preventative materials. And many have asked specifically about supplying masks. The current guidelines say that you only need to use a mask or a face covering if you cannot maintain 6 feet of distance between workers. And if you're using N95 respirators, they should be disposed of after 8 hours of use. If you're using face coverings, they must be washed daily prior to reuse. One of the other questions we've gotten is, how do we create social distancing in an industrial environment? Well, for some of the best practices, let's talk a little bit about workstations. And it's all about creating 6 feet of separation if possible, and providing signage, and also using transfer aids like trays to move the product from one person to the next. And if you can't create 6 feet of space, then you have to provide protective gear like masks to wear throughout the day, or install shields between workers as barriers. So check your state and local recommendations. For shift changes, it's all about avoiding group gatherings and make sure that everything is disinfected. So we suggest that you stagger start and end your shift times. Prop doors open to avoid touching the handles when there's heavy use, and consider hands-free alternative to punching time clocks. And if you can't, then designate a person to disinfect the time clock between each person. For lunch and break times, the main focus is social distancing and personal hygiene, scheduling those breaks and posting maximum occupancy for break rooms, and making sure that employees wash their hands before returning to work. One of our next questions is, how do we get employees ready to follow the new safety protocols? Before employees return to work, several key staff members need to be trained to update their roles in maintaining the health and safety of the workforce. And that includes, of course, the management team and HR, the disinfection team, and the isolation coordinators. And a lot of that can be done either virtually or in person before the entire workforce returns. On the first day, some of the things that you're going to want to make sure that you cover with the returning employees is, prior to any initial shift, all employees need to receive training on the new protocols, such as recognizing symptoms and the isolation protocol. We recommend training be done after clock in and divided by shifts or departments to ensure that there's social distancing. One customer in Texas divided his employees into separate training rooms in groups of 10 or less, and then they used Zoom to provide that training. important to address physical conditioning to prevent back-to-work injuries. Remember that people who haven't been on their feet for 8 or 10 hours a day for 2 to 5 weeks experience muscle atrophy, and this makes them more susceptible to injury. We recommend starting with a 10 to 15 minute of stretching before the shift. Another question we often get is, how are other companies handling employee and visitor health screenings? So we suggest to designate a person to screen everyone before they enter the site. Use touchless thermometers to check for fevers. And the current recommendations is checking for fever of 100.4 or higher, or any signs of illness like coughing and sneezing. And those are the people who should not be allowed into the facility. One customer in Greenville, for instance, is doing a drive-through screening in the parking lot, which has been very effective. And if that's not possible, you just need to make sure that you're screening people outside the facility and that you're keeping a distance of 6 feet while they're in line. Employees who are sent home will need to seek medical attention and get medical clearance before they return to work. We hope this overview has been helpful. If you download a copy of this presentation, you can link straight to this slide to a website page where you can download a variety of the checklists, forms, and other health and safety resources. Or you can visit the Voice of the American Supply Chain website to download tools and find more information on our series. That's employbridge.com/supply-chain-voice. Once again, this is Brian Devine. Thank you for your time this week. I look forward to talking to you next week when the topic is how to keep labor expenses flexible as we navigate through a volatile economic recovery. In the meantime, please take good care of yourself and the ones you love.